Welcome to All Things Policy, a daily podcast by the Takshashila Institution. We are a bunch of policy nerds based in Bengaluru, and we like bringing fresh perspectives to Indian affairs and Indian perspectives to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Welcome to another episode of All Things Policy of the Takshashila Institution. Today we're going to talk about antimicrobial resistance because it's World Awareness Week of AMR. And today we have with us Shambhavi Nayak, the head of research, and I am Vanshika a research analyst with the Indo-Pacific team. So, Shambhavi, tell us, why is antimicrobial resistance such a big issue? And why do we need to talk about it and have a whole week of awareness and not just a single day?
Yeah, I mean, it speaks to how big that issue is, right? The fact that they thought that an entire week was required to raise awareness, and whereas for a number of other diseases or emerging threats, we usually have days. So clearly, just speaks to the volume of the problem that we are facing, right? So let's break down to the basics. What is AMR? Antimicrobial resistance. I guess it's self-explanatory in many ways. It is microorganisms, bacteria mostly, who are getting resistant to antimicrobial agents, so antibiotics, which we have been using since the World Wars, and which have been quite effective in delaying deaths, in helping patients recover from infections, which, if you think about it, 100 years ago would have killed you, but now you barely notice it, and it just very rapidly goes away thanks to antibiotics. What we understand is that the same bacteria which these antibiotics have been created against or targeted against are now developing resistance. Now, this idea of resistance is not new. Antibiotic resistance has been in play ever since antibiotics have been used. And that is simply because this is not a biological novel phenomena by any road, right? This is just evolution at play. This is survival of the fittest in its most prime example. It is bacteria which are trying to survive against an odd. They are seeing that odd, which in this case is an antibiotic, over and over again. And the bacteria that survive, one round of that antibiotic, are going to then grow faster. So then the second round that these same bacteria get, there is going to be more population that is going to survive because they've already gotten the escape route to kind of escape that antibiotic, right? This is evolution, right? This is just happening at a microcosmic level. And because now when we have been exploiting antibiotic use for decades, we are seeing it at a scale which is massive. We are seeing deaths because infections which were earlier being cured by antibiotics are no longer responding. So it is the bacteria, obviously, that is not responding to the antibiotic. And so it has been estimated that about 700,000 people die every year because of AMR, because they have got infections which do not respond to the antibiotic that it would have traditionally, right? And it's widely increasing, widely spreading. It is causing a lot of economic damage as well. People are losing productivity, not just because of the deaths that happen, but obviously people are also taking longer to recover. And it's not just humans, this is animals, this is vegetables and wildlife. And, so antibiotics are used everywhere. Sorry, not wildlife, vegetables and plants as well. So antibiotics are used across the world, across species, by human beings. And what we are now seeing is, because of the rampant use of antibiotics, the rampant spread of antimicrobial resistance. Now, the fun thing about bacteria is that once a bacteria gets antibiotic resistance, there is, in addition to vertical transfer, so in addition to the fact that bacteria will transfer that antibiotic resistance to its progenies, it can also do horizontal transfer, so it can actually spread to other bacteria as well in that same population. And so it can very rapidly spread around the world. It is not just that it will spread as it grows, right? So existing bacteria will also develop resistance because of a variety of scientific mechanisms which are really interesting to learn about, but not part of this podcast. So there's a lot to fear about AMR. It's been notified as a threat by the WHO for a very long time now. There have been several approaches that have been taken to kind of address it, but it's one of those unique, like climate change kind of problems, where we see it as happening, but the effort to respond to it has to be of a global nature, which means it has to be of a slightly political nature. And I think that's where we are struggling with kind of responding to it properly. Again, as similar to climate change, there are economic factors that drive the use of antibiotics, despite the fact that we know that it is the rampant use of antibiotics that is causing the problem to begin with. So I think a lot of similarities with what, with like a global problem can be solved only through global means, cannot be solved by local means of any sort. So yeah, quite an interesting challenge, policy challenge to tackle.
Yes. So just to elaborate on a few things that you said. First was that you said this is evolution at play, right? So we have to understand this is a natural process that would anyway happen. But human action is accelerating it. It is creating it as a problem. So we see Darwin's natural theory of selection taking place. The genes that survive are continuing, and the ones that are not resistant are essentially dying off. But why it's making this situation worse is because we have overused it. Our intervention has made it worse. So it's interesting, you said something about the world war, right? So when antibiotic was discovered, I think 1930s, with Fleming discovering penicillin, and it was hailed as a wonder drug. We saw mass production of penicillin and other antibiotics in the 40s and 50s. So we see all pharma companies also jumping on the wagon. And so we see this mass sort of overuse of antibiotics slowly. And with that also came, I think, a complacency where we thought we won the battle against these microorganisms, where we thought we are one step ahead of evolution. But I think now we've realized that is not true, and the battle is still left to win, which I think is again.
I don't think it's a battle
yeah, that is
can ever
winnable.
be
Yes, exactly.
over. Like
Right.
it's going to be an ongoing battle forever. I mean, the first instances of antimicrobial resistance are as old as 1940s. So we started using them in the 1930s, and it was fairly quick that the
Yeah.
bacteria started responding.
Yeah,
to-
there are a
to
lot of
penicillin.
experiments which show you put certain antibiotics in a petri dish and let bacteria grow, and just
Yeah.
in 10 days
Yeah.
you can see
Yeah,
that
so
they've already
you put a gradient of antibiotic
Yes.
and you let the bacteria grow, and you see that they will
and
eventually.
you see resistant bacteria
Yeah.
slowly entering the part of the liquid which has the highest
Yeah.
concentration of antibiotics.
Yeah.
So yes, I mean that is extremely nature at its best.
That is just life.
Yes.
That is at the core just life happening.
Yes,
So,
and there's another interesting thing that you mentioned. I think it's called cross resistance, right? So we don't just see resistance being transferred within a particular species, but we can see that across species, which accelerates this process even more. And as you correctly mentioned, the toll that it takes and it has taken on the world, on the economy, on human lives, is absolutely appalling. And we need to understand the burden that this has been creating.
yeah.
Not only will we lose about 4% of our world GDP by 2050, but the amount of money we have to put in additional healthcare on like you said, using antibiotics, it prolongs your recovery period. So now let's come to some of the factors which have actually led to this problem. We've spoken about overproduction and overuse, but how exactly does this play out?
Right. So basically, what we are saying is that bacteria get exposure to antibiotics when it's long enough, when it's again and again, it's recurring, and particularly if it's in low doses, so that not all the bacteria die, right? That is basically your margin at which resistance will develop, right? What we have done, we have simply overexposed, right? We have used too many antibiotics. In humans, it could be antibiotics being given without prescription, right? You feel a bit of a sore throat and you say, oh, antibiotic, right? It's going to help us recover very quickly. But the human use of antibiotics is still fairly low as compared to the use of antibiotics in the animal husbandry sector. And that is because not only are antibiotics meant to help cure chicken and pigs and other cattle from diseases, they have actually been shown to be growth promoters, right? So you get a slightly more pumpy chicken if you're giving them antibiotics and vitamins in combination. And so that's actually a very lucrative incentive for the animal husbandry business to use antibiotics even if the chicken is not ill, right?
Right.
And so then we see rampant misuse of antibiotics across the animal husbandry sector. And now I think you have started seeing labels of antibiotic free eggs, etc. And that's very important because you should be able, I mean, you don't really need the antibiotic for a healthy chicken. Uh, but obviously, there's a nice little profit angle to using it. And so that has caused problems. So that's just overuse, right? Second is, and this is probably a bigger problem in humans, many people, when they are given prescribed a dose, will maybe take like 1 2 days, start feeling better, and then they'll be like, oh, I'm feeling better, I take more antibiotic. Antibiotics obviously do, because they kill a lot of your gut bacteria, also do have side effects, and there's fear of those. And so many people think, once they start feeling better, does that still give you benefits over the other side effects? And so they stop. The problem there is that once you stop, you might be feeling better, but there are still those bacteria, the ones that caused your infection in the first place, they're still hanging around. They're not all dead. But now you have taken away the antibiotic, so there is this low dose of antibiotic in your system that they're exposed to, which is really optimum for them to try and figure out resistant mechanisms, right? And so that is the point in your throat when antimicrobial resistance can actually develop. So the best thing to do is not to fall ill. If you fall ill, not to take antibiotic without prescription. And if you're given prescription, then to take it fully, because that's supposed to kill all of the bacteria in your system. So even if you feel better, just keep on taking the full course of the antibiotic. Right? So these are some of the reasons why we see so much resistance now being developed. There are other factors as well. So antibiotic resistance has also been observed in remote Amazon basins where there is no human contact. And one of the theories is that even climate change and other stresses are causing bacteria to develop resistance. And that resistance is somehow also being crossed over to antibiotics. Because, I mean, finally, what does an antibiotic do? It will probably bind something on the bacteria surface that allows it entry or allows it to kill the bacteria. And there are only a specified number of targets on any bacteria. So the idea is that if climate change is causing some kind of stress that is very similar in its way of acting as an antibiotic, the bacteria develops a resistance to climate change impacts, but it also becomes then resistant to antibiotics. This is also how, once you're resistant to one antibiotic, you can become resistant to multiple antibiotics that work in a similar action class. Right? So there are multiple factors on what is causing antibiotic resistance. It's just not the use of antibiotics, which means, I mean, we can take as many steps as possible to kind of prevent its spread. And we really just have to do what is in our control to change.
Yes, you're right. Especially when you discussed the use of antibiotics among humans. I mean, I've observed this as well, especially when you said that people don't complete their dosage, and which is why you give
Guilty.
them. And the opposite of that is also something I've noticed. If the doctor's written, say, 5 days, you have 2 or 3 per day, but you have a few, 5, 6 pills maybe left in that pill, and then what you think that, oh, there's just 4 or 5 left, let me just finish it off, why should I waste it, I'm still not fine. So I've seen people do that as well, which is again over medicating yourself. And I think increasingly, I'm not sure what the case is outside, but I know a lot of Indians self-medicate themselves. They'll go to the doctor once, maybe for something, and the doctor's written one antibiotic. Somehow they feel that the next time something similar happens, they can just refer back to that prescription and have that same
it's always,
medicine.
oh, I felt better taking that medicine 5 years ago that doctor gave me, so I'm going to take that now.
And I think obviously there are mistakes made on the part of the patients, but then we also see doctors initially prescribing broad spectrum antibiotics when maybe they cannot pinpoint the exact infection. And I think that also leads to unnecessary consumption, which will lead to resistance.
And particularly, I think because a lot of these are throat-based infections, you can't tell the difference between whether a virus has caused it or a bacteria. And antibiotics don't work against viruses.
Exactly.
But I think at some point of time, even the patient gets so frustrated with being ill and expects that the doctor
Yeah.
give something,
Yeah.
and an antibiotic is generally just
Yeah. Two
sort
diseases,
of anything.
Shambhavi, that I've noticed where people really overuse antibiotics. One is diarrhea and one is UTI. So in UTI, as you know, nowadays doctors, right, get a urine culture done because the culture helps to find out which exact bacteria is causing the infection, and then you can use. But culture takes time. So
Yeah.
what doctors do is before the report comes out, they'll give you a basic
Yeah.
UTI antibiotic that they think will work. And similar thing happens with diarrhea. The moment people have a diarrhea in a day or two, instead of drinking water or changing their food habits, they'll just fall back on some antibiotic, thinking
Yeah.
it's going to work. So these are, I think, two issues which you know contribute to excess, and people think it's something very harmless because antibiotics are usually low cost and low toxicity, so even doctors do not feel that they are sort of overextending themselves, and they just feel it'll help the patient anyway, even
Yeah.
if it has a placebo effect.
Yeah.
Which I think is why we're facing this.
Yeah, even pharmacists, right? A lot of
Right.
pharmacists will just give you antibiotics. At least they used to. I think there's been a lot more limitations and monitoring of the delivery, particularly through COVID.
Yes.
Because through COVID, we put in, it was looked on as paracetamol basically was looked on as an indicator of whether people were not reporting COVID.
Yes.
And there was a lot of curbs that were put. So yeah, I think
Yes.
and that has definitely gotten better. The prescription requirement for antibiotics is better, at least in urban areas. I was very recently in my village. My mom was not well, and I wanted some medicine, not an antibiotic, but I wanted a medicine which I knew in an urban center they would have asked me for a
Prescription.
prescription. So I had a virtual one with me, but they did not ask. So I think still in rural parts maybe that, and I can understand where that comes from, right? I mean, you have like maybe one doctor in the village, you have one chemist. I mean,
Yeah.
it's very
Yeah.
difficult to always
Right.
have a prescription in hand.
Yes. And you mentioned COVID. So this is very interesting because while the world sees COVID as a moment where there was a very large, successful global sort of converging of ideas, of technology, of this acceptance that okay, we're all in a crisis, and so we see the world coming together when it came to treatment and all of that. But I think there was something else that we missed. That one was there was a significant rise in secondary infections that we saw in hospitals among patients that already had a compromised immune system. And the second, which you already mentioned, was massive use of antibiotics for treating COVID, which is essentially caused by a virus. So that would need antiviral intervention and not antibiotic. But I think this is something that, as you mentioned, somewhere you went in not very urban centers. I think people still don't understand. Even doctors wouldn't understand the difference and just prescribe antibiotics.
Yeah.
So
They
what do you
would, yeah.
think were the what are the repercussions of doing something like this, and do you think we've scaled back on that?
We have definitely scaled back on our antibiotic use. And that I think is, I mean, globally, the high income countries have done very well for human use in antibiotics. The low and middling income countries are still have a lot of scope for improvement in their antibiotic prescription and use. But it has been dialed down. There is an increasing awareness of what antibiotic use can lead to. I think one of the problems that AMR faces, that you know the thing about uh, COVID was a very visible, attributable threat. AMR is not that, right? When I say 700,000 deaths caused globally, they are not marked as AMR deaths, right? These are people dying of infections, and so they get staggered into like smaller groups.
Right.
So we are not looking at AMR as while it's recognized as a global threat, we are not actually seeing or hearing that people have died, right, of AMR. Right? When someone in your circle dies of AMR, that's not what you say. You say they died of an infection.
Yes.
Right? The fact that that infection was probably curable, that part we don't always talk about. And it's difficult. I mean, it might also be that the antibiotic that the bacteria were responding to the antibiotic, but other things did not work out for that person. So it's really difficult. But I think that's one measurable kind of an impact that we lose out on. And at the end of the day, the person died, or was ill for longer because of the infection, not because of AMR.
Yes.
And that lack of attribution, I think, kind of drives the way policy thinks about it, the way healthcare workers will think about it. So that's, I think, one kind of challenge that we'll have to some way surmount when it comes to AMR, as opposed to other infectious diseases, which are much more needy to be attributable. I've forgotten your question.
Yes. No, that's okay. I think you've identified a very important challenge. And we even observed this during COVID, where a lot of patients are actually suffering from pneumonia or tuberculosis. But then because of COVID, it was just overshadowed. And we know that the, the microorganisms causing pneumonia and tuberculosis are some of the most resistant bacteriums out there, right?
Yeah.
So then this was observed across the world, across developed countries and developing countries, where a lot of people dying from pneumonia were counted under COVID deaths. So, like you said, what name are we giving to this? Because there are a range of diseases, and because AMR manifests in every individual very differently, right? So you can be, your antibiotic resistance in your body can lead you to develop some other disease, which can lead to sepsis, which can lead to your death.
Yeah.
So, like you said, we cannot pinpoint one factor, which makes the visibility of this very, very low. And coming to talking about COVID, we saw a resurgence in the idea of vaccines. So recently there was a WHO report that said that, with better use of vaccines, we could actually reduce antibiotic usage by almost 2 billion doses annually. And this is because there are certain diseases which can be controlled by using vaccines, but the problems are that they are underused or they are not brought to the market immediately. So, do you think that given how much, we've seen progress in, vaccine partnerships and in spread, do you think this is a sustainable, a viable way to combat AMR?
Yeah, I mean, like I said, the first easiest way of combating AMR is not to fall ill. So you don't need the antibiotic in the first place. So there is no scope for the bacteria to become antibiotic resistant. Now, it is not that easy not to fall ill, especially in urban centers, where you have smog and you have pollution. And so every day you see adulterated food coming in. You don't know what's in your vegetables, and there's a lot of stuff that happens, that is where we are exposing ourselves to microorganisms, right? To bacteria that can actually cause disease. So vaccines, in from a health perspective, are great. Right? They are not economically as lucrative as antibiotics, I suppose, because a vaccine. I mean, the flu vaccine, I think, is the most frequently given vaccine. So once a year, because the flu virus changes every season. But a lot of the other viruses, you take a vaccine once and then you don't have to take it for 10 years, or maybe there's a couple of boosters. For the pharma company, that's not really a great incentive, right? Because you have lost a patient.
Right.
Because you suffer from an infection once, you are very likely to suffer from it again and again and again. Because our immunity might not be that great. So antibiotic in that sense is economically more profitable, I guess, for the pharma company than the vaccine is. So we need to incentivize it. What I'm saying is that vaccines are great. We need more vaccines.
Right.
We need more vaccines in the Indian market. We need more people to be taking vaccines as well. And a lot of diseases which are preventable, and I don't know why people don't take vaccines, right, for those. But yeah, in the health sense, they are great. Economically, we'll have to create incentives.
Right.
We'll have to show market size, especially for some of the neglected diseases, more tropical diseases, where there is, where a lot more of the LMIC countries are also based, where the market might not be paying as much as they would in the US or the EU. So we'll have to figure out the correct incentives for the pharma companies to come up with vaccines. But yeah, I think vaccines for preventing, I don't think you can prevent this anymore. For stalling the spread of antimicrobial resistance is going to be critical, especially while keeping in balance human health.
Right. So there were some important points you made there, Shambhavi. So one, as I understand, talking about, profitability and the economics behind it, we're seeing a problem with there's a pipeline and access crisis in antibiotics, right? So we mentioned how there was a surge, there was an antibiotic boom in the 50s and 60s, but suddenly in the 80s we see a decline. We see pharma companies not investing enough in antibiotics, and even today it's continued till the 2000s. And so, as you mentioned, the one of the biggest hurdles is that there is a misalignment of incentives. So while the government and health services, they are incentivized to promote this, as a prudent, as a common good, but on the other hand, companies are just incentivized to increase sales and maximize profits. So how do we, get these two aligned? I think this will be one of the major policy challenges that any country going forward. Just a political question here, because I feel this. I just need to ask. We're seeing the new Trump administration in America, and we've seen Trump being very vocally skeptical about the use of vaccines, and he has spoken about appointing his new health secretary as R. Kennedy, who is also a very open vaccine skeptic. So, given that one of the largest countries in the world, one of the pioneers of biotechnology, has suddenly people in power who do not believe in something like vaccines, and what repercussions will this have for global health and for our fight against AMR?
Okay, lots of questions then. Okay, let's take it. Let's
Okay,
take
yes,
this one by one.
that was a big one. Sorry to put it out there, but
No, look,
yeah.
let me talk about the Trump administration first, right? Even if RF Kennedy comes tomorrow and says we're going to dismantle all of the vaccine apparatus because he believes, and there's no proof of this, and in fact, there's proof of the opposite. There is no link between vaccines and autism. Even if it dismantles everything, right? I think the good thing is right now is that USA is no longer the sole hegemony on science and tech. Right? India is the biggest manufacturer of vaccines in the world. We now have strong capabilities for creating our own vaccines. It could be the mRNA vaccines, it could be adenovirus, etc. We have demonstrated this through COVID. We have demonstrated this through the fact that we now have an indigenously made rotavirus vaccine, etc. So the repercussions of the US standing up and saying that we don't believe in vaccines, I don't think they will reverberate to a great extent within the health community, because I think the health community globally knows that vaccines are brilliant and they work and they save lives and they are rivaled only by clean water in terms of the impact that they have. Right? Everybody knows this. There might be a few people in the room who will shut their eyes and say that they don't believe it, and it's frankly their loss. Uh, it just means that they have ceded space as science leaders in the world, and somebody else will come and take up that place. Hint, hint, wink, wink. This is our chance to shine.
Right.
So it doesn't really worry me. Would the narrative change in India? I hope not. We have a really strong universal immunization program that the government runs, right? We give 9 or 12 vaccines every year to all our children, and the impact of that is clear, right? Our mortality rate below the age of 5 has reduced dramatically. People are living healthier, people are living longer. Parents are seeing their kids being healthier, right? No one is going to contest with that, right? Yes, there are groups here and there who have had anti-vaccine philosophy, but as long as I think the UIP runs and we are robust with those systems, we'll be fine. The blip for me is when in COVID-19, we did not disclose all the data related to vaccines, both the AstraZeneca one as well as the Bharat Biotech one, before approving them.
Yes.
I think if we had done that with a bit more faith in our society, that could have, faith that our society understand the risks and will still take the vaccine, that might have promoted more trust in the science and technology behind those vaccines. And I think there's still a chance for us to recover from that. Is blips that scare me more than what happens in the US. So on the vaccine front, I'm still more positive. The mRNA vaccine platform is something that we seem to also have been now embraced. There's research going on in trying to bring that to India and create more vaccines for indigenous diseases, which is all, I think, great. In terms of AMR, since it's a globally recognized threat, So the WHO came up with an action plan, the GAP, the Global Action Plan, and all countries were supposed to come out with their own national action policies, which most countries have. Their implementation across the world has been mixed. So some countries have done fairly well, some
Right.
countries have not. But most countries have focused on research on more antibiotics as one of their goals. Argentina, I remember, has an interesting clause that says that look, we recognize that the animal husbandry uses this for growth promotion, and so perhaps substitutes for growth promoting activity of antibiotics is something that will be can be researched on, because that would basically remove the use of antibiotics in that sector, right? There are technical limitations to how we detect antibiotics and how we use them, how we can create substitutes or second generation, third generation antibiotics. I think to some extent those scientific limits had been reached, but now again with the formation of larger data sets, access to a lot of data, use of AI for analysis of those data, we should be able to find newer and newer targets on bacteria, etc., that we can use to create new antibiotics. So as I said, when so a bacteria will expose a particular target which the antibiotic binds to, right? When it becomes resistance, one of the various mechanisms that it might have is to remove that target from its surface. Once it does that, all antibiotics which might be binding to that target will not work on that bacteria anymore. So we were
Right.
limited to an extent because of things like this. Uh, but now I hope discoverability of both targets as well as binding structures to it will be improved. So we can now start seeing synthetic antibiotics and other things. But yeah, uh, again, all are nice options. But the first thing to do is, is invest in like simple stuff like hygiene, sanitation, not fall ill to begin with.
Right. Just talking about some new tech that you mentioned, there's something that I read called phage therapy, where basically you use bacteriophages, which are viruses that kill bacteria. And I
Yeah.
think that is a lot more targeted. And
Yeah.
could you elaborate on that? Where are we? What's the status? Are we making progress?
Yeah, so we don't really have a policy or a guideline for the use of bacteriophages in India. There are a few examples where it has been used, but again, very small cohorts to actually be able to deduce much. Supposedly, there's a lot of success with using them, but it's it has to be there has to be a bit more focus from the government on how it can be used, in what conditions can it be used. I think that will be very helpful in pushing for more bacteriophage therapy in India.
Right. So another thing that you mentioned is how Argentina came up with, they have a clause where they want to focus on replacing antibiotics as, growth treatment. So talking about the use of antibiotics in animal husbandry, I think we don't realize how much, obviously, we are consuming antibiotics and affecting our own body, but how much of the resistance you're picking up from the environment. So, what are some of the maybe suggestions you can give to our listeners on how to avoid you know food that might have a lot of antibiotic and something like that?
Okay, I'm going to put a lot of faith in the Indian and state governments and assume that the FSSAI, when it says it's monitoring, it's monitoring. So stuff that is labeled antibiotic free is actually antibiotic free. So a pretty lot of trust in the government as well as the companies which market these things, right? So assuming all of that is true, antibiotic free is one way of consuming organisms. Organic is technically supposed to be antibiotic free. Also, it is not just that by consuming these animals, you're consuming their antibiotics. The thing is that resistance can develop in them. They may be excreting these antibiotics because they have excess of it, and that in the runoff to the waters,
Right.
etc., resistance can develop there. So resistance can develop
Anywhere.
anywhere and spread across to bacteria everywhere. Um,
Yes.
yeah.
I think it's the same even when we throw away old medicines. I don't think, especially given the waste policies in India, it's just everything is we just dump things and they go into a big landfill site. And probably, like you said, those medicines are also leaching into the ground, into the water, and which is leading to bacteria, developing resistance. So I think we forget that we're just one variable, we're just at the intersection of a very large, of nature being at play.
Having said that,
Yes.
I don't want to dishearten everybody. You're all very important. Every single person who stops indiscriminate antibiotic use and adheres to appropriate antibiotic use is one more soldier in this fight, right? So don't think that the problem is too big and me popping an extra pill is not going to change anything. That's not true.
Oh yes,
Every pill
this
matters.
was not trivializing any human effort, Shambhavi, and you're absolutely correct. I think all of us must, if we seeing a family member, doing something like that, where they're self-medicating or overusing antibiotics, I think we should definitely, like you said, tell them about it, because even that one move, that one step will go a very long way in AMR. So coming to finally. There are a few, I think, ways that we can tackle AMR. One, as we discussed, is innovation in science, where companies invest in R&D, they invest in developing new strains of antibiotics, which maybe take some more time to get resistant. Phage therapy, we've discussed that. Second comes to policy regulation. I think we definitely need stricter guidelines and enforcing them both in healthcare and in agriculture. Third, goes without saying, is public awareness, as we just discussed, and education, where I think AMR is something that should be there in every school textbook. I think the moment you inculcate this with childhood, you will see a new generation that will be a lot more mindful about just popping antibiotics left and right. And lastly, since you mentioned the WHO, I think, as you said, this is a problem that's transboundary, that's not limited to any nation. Just like climate change, we'll see its effects spreading over other lands and all seas. So we need urgent global collaboration on it. And as we saw during COVID, we saw a lot of philanthropic funding coming into this. So do you think there has been some sort of initiative by non-governmental actors in tackling AMR? So just to summarize, I think we have established that AMR is a global threat, as the WHO says. The Director General said that AMR could unwind 100 years of medical progress if we continue at this rate. So, any concluding remarks, Shambhavi?
No, I think AMR is a big enough threat that it doesn't even deserve. I mean, it should be more than a week. It should be AMR awareness every day, because you and I might not see this as a big challenge, right? Because we have not clearly, unlike COVID, where most people know someone who died of COVID. We don't know people who died of AMR because it's not labeled so in most cases. But given another 10, 20 years, that's not going to remain the case, right? So for the sake of our children and their children, it is necessary that we make amends right now. We have, knowingly or unknowingly, pushed ourselves into this AMR debacle, but there's still time to change. There's still time to rectify the mistakes. And the time is right.
Thank you, Shambhavi, and thank you to all our listeners for tuning into this episode.
Thank you. Thank you, Vanshika.
If you liked our show, dive into Takshashila's research on technology, strategy, and economic affairs. Check us out at our Twitter handle @Takshashila INST or our website takshashila.org.in.